Hello, everybody. It's Dr. Bar. Welcome back to my channel. And today I'm going to be talking about some soft issues or mild symptoms of what we call erection troubles. And we're going to unpack the why and fix it fast. Thank you again. And here we go. We're going to start with the first slide, just defining what is ED, because most of the patients have very mild cases of ED. So men, usually around their middle age, have an issue with firmer erections. They're not enough for sexual activity. So that's basically the definition, that they erections happen, but they are not sufficient for them to have a full sexual satisfaction. And it's more than just one time. So this has to happen more than once, and it's a recurring problem. So if this happens once, it could be psychological issue, you're stressed, you're tired or something. But when this recurs, it makes intimacy a problem. Like there is challenges with that. And then it affects over 30 million men in the United States. So it's a very common situation here, but it's very underdiagnosed. People don't talk about it. And unfortunately, if we look at the curve here, it starts at a very early age. So we have younger men, maybe in their 30s, probably having these symptoms. And when we see them in the office and we do, like, there's a questionnaire, like a sex health assessment, and there's a score out of that. And it doesn't have to be 100%, problem, but you can see that they are having issues. And that's the mild ED that we talk about. And it can start at a very early age. Unfortunately, it's not an old man disease. So, early signs to watch for, these are things that I want you to just be kind of aware of. So, trouble getting an erection in the morning is a very important thing. So, occasionally, this can be, once a week it's fine, you don't have a morning erection, but having morning erections every day is a sign of like your testosterone is, which is normally rises up in the morning, and that's where I wanted to be like a clue for you. If you're not having morning erections, it is something that you want to really kind of address with your doctor or sexual health physician. So again, erections are not firm throughout the process. So you get an erection, but it doesn't last throughout the time that you want it to last to complete a satisfied sexual act. And then also, there's reduced sexual desire. So the libido is reduced. And again, if that is the case, there are different pathways for that we can kind of diagnose and figure what the problem is. And it's not the blue pill at this point, because we're going to talk about the causes. So there are a few causes. It's not one reason where people have an issue. So the first one that is very important that we need to address is plumbing issue. It's tubing, it's vascular. We are made of a vascular, very intricate vascular system. Our circulation is very capable of rushing that blood supply and getting that erection. It's all about like having that engorgement, and then the erection starts. So that's the very first part that usually a lot of men suffer from with age, with hypertension, with diabetes. There's so many reasons for us, especially aging, eating unhealthy, cholesterol plugging the vessels. So there's so many reasons for those blood vessels. A plumbing issue would be the first thing. Second thing would be neurologic stress, having issues with work or psychological issues like in life that can actually create a psychologic or neurologic issue if we have nerve damage. And that can happen again with chronic diseases like diabetes, for example, is a very common one. So we want to address that. And of course, one thing that's very unusual and people don't talk about, COVID is one issue. And then, of course, heavy metals. So vascular is the first one. Neurologic nerve damage is the second one. Of course, nerve damage can happen if somebody had surgery, prostate, surgery, and there's nerves damage. That's another thing, cutting through surgery. Hormonal is the very common thing, and most people think about it. It's like, oh, it's a low T. This is, again, misconception. It's not only T. We're not made of one hormone, you guys. You are made of like 3, 4 hormones that are essential for your erection and ejaculation and orgasms. I'm going to call a few. So testosterone, DHEA, pregnenolone, prolactin, oxytocin. So there's few of those. Even the imbalances of estrogen would cause problems with your erections and ejaculations and sperm count. Again, it's very important to check all your hormones. So again, hormonal imbalance, we're very, very, very complicated beings, and all this gets together and creates that very amazing act that is like so coordinated, and so many things can happen. So, erections rely on a healthy blood supply, as we said. This is triggered by nitric oxide. I want you to learn about nitric oxide. It's one of your favorite things that you need to be making sure that you have enough of it. It is so important for your circulation. It's one of the reasons you have an erection. And again, it accounts for 50 to 70% of organic ED causes. So, we don't have enough of it as we age as well. It is in the food. You can take a supplement. The American Urology Association's, the AUA, and May Clinic has these data, and it's very important to, again, consider nitric oxide. Emotional physiological issues are important. They're not very common, but they're very important because they're very easy to fix. So again, emotional issues, psychological issues, example, if you're stressed, if you have anxiety, so there's a way of you to relax. And the more you think, oh my God, I can't have an erection, the more it gets worse. So you really have to reverse that kind of like feedback. So it can happen alone, but most of the time it can happen in younger people. A lot of issues, stresses right now that happen in life. Again, this is something that could be fixed, and it's not a problem. Now, a combination of organic and psychologic is the common thing. So I want to address this because sometimes you would have blood pressure issues, or, people say, oh, you're pre-diabetic and so forth. And then you have a little stress. So when you have all these together, that will create a soft ED issue, right? So it's very important to manage these things and not let them affect your life, because it's not hard to kind of change your lifestyle, eat healthy, reduce your blood pressure by exercising better, taking magnesium, nitric oxide. As I said, it will improve your circulation. So why not for nitric oxide to help your blood pressure? So all these things you can address with your doctor, because we are, again, not one problem will cause ED. So early detection matters because we can reverse all that. We don't have to wait till things like deteriorate. So the blood supply, again, if the blood vessel is getting smaller and kind of tighter and cannot produce the blood supply, that's the first warning symptom, because that size of the penile blood vessel, the next one bigger than that is the heart. So it's just the warning symptoms. And that's why they say, you can't just go ahead and go take Viagra, because you increase circulation down in the penis. Guess what? Heart attack will happen if you do not have enough blood throughout your circulation. So that small vessel, the next one to be plugged is the heart. So it's a warning symptom. That's why you need to get checked, right? So early detection is very important, and early detection determines better outcomes. And that's why I'd like to see my patients early, do the questionnaires, check on everything. Because if I just ask my patients on the general exam, like, okay, do we have ED issues? No, I'm fine. I'm totally fine. I have no problem. But you need to dig deep and go through the symptoms, do the questionnaire, do the labs, check all the hormones, right? So the risk factors that men should know, again, the lifestyle things that you can work on. Overweight is a big thing, inactivity, smoking, all this affects your circulation, affects your blood supply, and of course, it's something that you can help, kind of reduce. So high blood pressure is an important thing that you can kind of manage, because if you're having high blood pressure, there's so many also natural ways for you to reduce the blood pressure. And sometimes like just reducing your weight would help you with the blood pressure issue, right? So it's the risk is higher, 40 years and above. And if you don't check your blood pressure, you will not know. So they're very easy to get them now on Amazon. You get a little wrist cuff and you check your blood pressure every day and your heart rate. Lower heart rate will make you live longer. Blood pressure ranges, you can easily get those levels online. When we're young, it's 120 over 80. The systolic over 80 is diastolic. The lower the levels, the longer you live. These are the research and studies. But you can figure out what is your normal. There's charts on Amazon and Google and all that kind of stuff that you can download.
It actually is the new technology that actually
video
can
about Kegels.
enhance the circulation, improve the muscle function, in the pelvic floor, the bladder, and also sexual muscle. So this is like having like 20,000 kegels right now, but I like this machine because it's really amazing for men and women. And sometimes we don't think about our floor muscles, which is like the pelvic muscles and our muscles that actually support us, where it carries on, helping us like for the bladder, for sexual health. It's very important to think about it. This is the only machine that I know of that can actually treat a lot of the diseases and the weaknesses that we have in the pelvic floor.
I understand. And I believe this is a new machine, right?
It is a new machine, just got actually approved recently for bladder function. So a lot of people sometimes have stress incontinence, and it's been featured on the doctors, they talked about it. So occasionally, this is actually for men and women. So for women, it happens earlier than men because unfortunately we have the babies and there's a lot of pressure and a lot of strain on our organs in this area, and we start having a little bit of stress incontinence when we sneeze or cough or laugh too much and the bladder is full, there might be a little leak, and unfortunately the only treatment to fix this is surgery. Until we, of course, and a lot of side effects, but now we have a very non-invasive way of treating patients, and it's 6 treatments, and it's actually got a FDA approved for stress incontinence. Men might complain differently, of course they don't have babies, but waking up at night is another symptom, so people wake up at night 2-3 times, interrupted sleep. So imagine if this is reversed and people get a very restful sleep. That would be great actually for health.
Dr. Barr, I'm glad you shared that with me because a lot of the time what men do, they blame their bed.
Yeah.
So a lot of times it's not the bed. It's more to it, right?
Yeah. Blaming the bed, or I drank too much water before I went to sleep. Unfortunately, it's a weak bladder, and it's good to strengthen those muscles. And the benefit or the side effect that comes from it is it works like a blue pill. So it helps the circulation. That's what the blue pill does. And actually that's an added benefit where sexual health becomes a really add-on for benefit, yes.
So there you have it. It's not just for women, it's also for men. But ladies, I definitely have to keep you updated on this because I will be trying it.
It's our favorite machine in the office. Everybody coming in wants to try it.
Definitely.
Favorite machine?
So I guess this was a really cool presentation of how we can improve our medical outcomes through machines. Now we have the technology. It will improve your pelvic floors. It's great for ED. Actually, I tell everybody, especially men, if you want to get better erections and ejaculations, pelvic floor is very key. Do your Kegels, right? And squats are very important. Strengthen your lower part of your body. So I will touch on testosterone therapy because that's important. Testosterone therapy, we call it like testosterone, but it's all the hormones that create testosterone. And that includes your vitamin D. It's very important. The first molecule that makes testosterone. After that, you have your pregnenolone, your DHEA. Most men should be optimizing your DHEA. Again, low T is a problem that we see with older age. As we age, and sometimes even 40, we start seeing like low T. The typical energy reduction, lower libido, erection, is the last thing to be affected in sexual health. But unfortunately, like losing muscle, going to the gym, feeling that you can't get improvement after your workup, just the fatigue in the afternoon, you can't just finish your day. Lack of motivation. So restoring all these things happen by balancing your hormone. It's very important. It is very easy to kind of balance. So again, it slows down with aging, 30 to 40% issues with ED in the score. So the side effects of the hormones are very minimal. If you're doing the right amount of hormones, you should not have an issues, right? So balancing is key. Getting physiological levels is important. It's not a cure for ED, but if you have low T, that will be a problem. Now, I will talk quickly about some peptides. We can address those as we go. There are kisspeptin, one of my favorite hormones. It's a hormone that it's actually a peptide that we can make actually right now compounded. And how it works, it triggers your growth hormone releasing hormone. and gonadotropin releasing hormone, both the pituitary and hypothalamus, the brain organs that are, centers that releases the testosterone. So I like it for younger people because it can boost your own testosterone naturally. The same thing like other ones I'm going to be discussing, but this is like how our brain sends the signal to the testicles. So these peptides are very important, and it helps to protect your own testosterone being released. So it's very important. It is effective for people at a younger age where there is a pathway connection still functioning. It can help with ED if that is an issue of hormonal imbalance. And usually they're injections. They're small, very small needles. We can do it every day. Same thing with HCG. Most of you heard about HCG, human chorionic gonadotropin. It's a big word, but anyway, it is the one that stimulates your, again, centers. So I like to tell young people, please do not take testosterone, because if you're young, 30, 40, even 45, and you still want to have babies, your centers can create that signal through these peptides or HCG to release your own testosterone. So that's very important. When you take exogenous out or injection from testosterone or outside testosterone, you suppress your own body, and that is for life. You kind of suppress your own pathways to produce testosterone. So the way HCG and kisspeptin, for example, works, or gonadotropin, these are other peptides that stimulate your center. It preserves your own body and helps it to produce testosterone. There's a way of testing for that. Not everybody can get these peptides, so we check for LH and FSH, and if your pathway is working, it will help your ED if it's low, right? Unfortunately, they're most of the time they're injectables, and you will need to be taking those every day. So other things that can help with libido, because I mentioned libido could be an issue. There are peptides for libido. I like to talk about the PT141. That is a very small peptide, again, that we actually can use. Sometimes we do it sublingual or injectable or even intranasal. How it works, it stimulates your nervous system to boost your sexual desires. So that's different than using it to improve the circulation. So your pills and all the other testosterone would increase, for example, your circulation or nitric oxide. This one works on your center to increase your desires, your libido. It works actually for men and women. When we do the injection, it takes a few less than an hour to work, and it works for a few hours. It's very important to actually gauge the dose. You don't want to take too much dose. We adjust that for patients. Very minimum side effects, sometimes a little bit of headache. Again, you adjust the dose. The duration can last for very long, very prolonged erection, and that's a problem. So we want to make sure that doesn't happen. Again, a little bit of nausea, flush is very common too. Nausea and flush is sometimes a common symptom, but we adjust the dose, and it's usually very mild, and it works amazing. Guys love PT141 peptide. Now, the medications, the blue pills, the Cialis and Viagra's are, again, effective for 70% of the men. Unfortunately, after a while, they stop working. So they work for a few years, and after that, they don't work. Again, they only work on your circulation, on your blood supplies, right? The PTE, it's like 5 inhibitors. So the same idea that we were talking about, that you will have problems with your circulation, that's why the erections and engorgement doesn't happen. These pills just drains the blood and puts it all in one area. And again, you might have headaches. People might just draw the blood from the heart. Some people would have like the double vision and stuff like that, which is a warning symptom, right? You just don't want to be taking those like a friend gives it to you in the gym and it's like, hey, take that, try it. You need to be under proper supervision. So to avoid these side effects and concerns, God forbid. So bad side effects. Another thing that increases the circulation, which I like to sometimes recommend, I say it's like taking your penis to the gym, is using those vacuum pumps. They're really useful. They can work. If you are okay with that, you just watch the pressures. There are ones with a gauge. So I mentioned them before on my Instagram, which pump to choose. These pumps, you pump for a couple of minutes, and you have an erection, the erection lasts for a while. You get your, erections and enjoy sex, and then it goes away. And it's a mechanical pump, so it's very easy. You just can create a mechanical effect by engorging the blood vessels at that point. And sometimes we recommend them after doing the P shot. P shot is one of the procedures now that we're using. It's a new procedure that I really like because it is reversing the aging of the penis. Whether it's the blood supply that we talked about, increase the circulation, brings more blood vessels in the area. We use it through using drawing your blood and circulating the platelets and just putting them back into you. And then also it increases the growth of your nerves back again, which is amazing, right? Also, when injected in the tip area, of course you're numb, you don't feel anything. Enhances the sensation. And finally, some people like to do this for increasing the size. So it's like a filler for men. So cosmetically, men, if they want to have a bigger erection and enhanced function, we do the P shot. And that's when we use also the pump at that time to stimulate after the procedure. They bring everything in that area. So, exercise is very important. I'm going to tell you some of your lifestyle changes that you need to do. This is on you now. So, exercise in 30 minutes. I like the pulse exercises or burst exercises, running from the saber tooth tiger. Again, exercise is very important for your lower pelvic muscles. This is very important. Your Kegels. I've mentioned Kegels on my Instagram, but you can come and do the machine in the office. This is very important for building your pelvic floor. There are muscles that are important for creating the erection, the ejaculation. And then also, what is important is your glutes and your thighs. So, squats are really amazing for men. Diet is very important. I usually recommend the Mediterranean diet. It has your nuts. You can do Brazilian nuts. It has your omegas. You have your salmon. You have your eggs. You have your red meat. If it's grass fed, it's healthy. It's not going to cause problem. Eating it with vegetables will reduce the cholesterol issues and have the fiber with them. So again, I have a pill for men that has all the stuff that increases your L-arginines, the rich foods in L-arginines is important, the citrulline. So I've posted that also on YouTube before, the food that can raises your testosterone and help you with libido. Nitric oxide, I usually recommend it as a pill for most men. Creating nitric oxide is so key. It's in pomegranate, but you have to have a lot of that stuff. Like pomegranate is one of the good sources of nitric oxide. There are other sources as well. But again, remember, stress management is key. Try to reduce your stresses. You time manage your relaxation time. Psychotherapy is important if we need to, or feedback, do tantric yoga. I love tantric yoga because it's not only doing yoga, but it enhances your tantric yoga is a very ancient science. Check it out. It improves your kind of whole kind of sexual relationship with your partner as well, increase sensuality and all that. So not only you're doing yoga, you're just like having great time as well with your partner. Finally, I'm going to talk a little bit about supplements. Some of them are easy to find. Make sure the source is important. Vitamin D is very key. Your L-arginine, your ginseng, your nitric oxide, and of course, DHA and pregnenolone, I prescribe them actually. So I adjust the dose per patient. It's very important to make sure that your DHA and your pregnenolone levels are at a good level to create testosterone. So I check the whole curve there and make sure your levels are fine. You can supplement, but just do not overdo it. Make sure you're taking the right doses or following up with your physician. This is just an educational video. I hope it was useful. Subscribe, send me a message down there at the bottom or on our website. Just let me know if you're interested in specific topics I'd love to talk about and kind of educate. Just thank you so much. I appreciate your, taking the time. Don't forget to subscribe, and I'll see you soon next